Okay, so I'm going to imagine you're coming here because you've been told, pull your head back. Why is your head sticking forward? Sit up straight. Fix your posture. Have you heard of that term, forward head? And you try to fix it, but your body keeps resisting? I want you to hear this first. It's our whole lifestyle that's creating this posture. And you're going to see today, I'm teaching this because I need to learn it. You're not failing in your posture. Your nervous system has been steadily adapting to what you're asking it to do all day long. If you have a forward head, chances are you sit in front of a computer for hours a day like I do, or you're driving, or you're pushed to get to places faster than your body wants to go. Forward head posture isn't a bad habit. It's a strategy. It's a strategy our bodies learn from screen times, from stress, from vigilance, from long hours of focus, emotional bracing. Could be old injuries, old motor vehicle accidents, or environments that just ask you to lean into life before life felt safe to actually lean back and receive. So today we're not here to correct or force anything. Be compassionate with yourself. But I'm going to talk to you about some physical therapy approaches for addressing that forward head in a way that sticks. And most people don't talk about this. I'm actually here to invite you to listen to your body. Because where your head rests in space affects not just your nervous system. It affects how you breathe. It affects how your jaw holds tension. It affects how blood flows into the brain and how safe the nervous system feels in your body. And when safety returns, posture can reorganize itself from the inside out without trying to move against the pattern you try to force on it. Let's work with the body. Because really, posture is like a nervous system communication to you. Think about it. Your head weighs about 8 to 12 pounds. And when it drifts forward, even subtly, that 8 to 10 pounds is like holding a bowling ball, but instead of holding it here, you hold it out there. And what's going to give up? Your shoulder. When you do it with your head, it's your neck. Your whole system has to reorganize around the load of your head being forward. Not because your neck is weak. It's actually intelligent. It's doing the best it can to hold up this weight. And so all these adjustments get made and compensations. So forward head posture often shows up when the body is in a protective state, where there's a sympathetic push, over-focusing, striving, bracing, screen concentration. Sometimes your eyes need checking. Have you ever thought about that? Maybe you need glasses that let you sit back. You shouldn't be that close to a screen anyway. When that forward head posture is there over time, there's fatigue. Or have you ever noticed like you try to lift your head and it feels so heavy when you're lying down? Like it literally can't hold itself up? It's like a trauma reflex. The jaw tends to clench when the head is forward because all the musculature here is pulling. There's like a readiness to respond and this tension, but we don't need that. It's not wrong. It's just that when you soften that adaptive response to the environment, your demand, and you let your forward head resolve back so your body's holding your head, you actually start to reshape those invisible and visible patterns inside. When the head moves forward, your rib cage often depresses and it stiffens. And your lower ribs tend to widen out and they lose their freedom. So instead of breathing from a deep, full diaphragm, we tend to breathe up here. There's a lot of forcing. And this upper chest breathing is much more a vigilance breathing. It's like what kicks in when you're trying to run away from a lion, except there's no lion. Your neck and jaw muscles have to work overtime to try to pull in more air. It reduces your lung efficiency. It's a breathing adaptation, and the body learns to prioritize alertness and readiness over ease. And over time, guess what? It keeps the nervous system in a low-grade cycle, a stress loop. Your sleep is more shallow, it's more difficult to calm down, or you may get anxiety for no reason, like what is up? Think about forward head and decreased breathing. It also can make pain in the body be much more sensitive. You get triggered easier. So when the head gently lifts and rebalances over the rib cage, not only does it ease the flow of energy from your head to your chest and back, but the breath doesn't need to be trained or forced. It just returns naturally. Like soil that kind of softens once the pressure is removed and the path is lifted up instead of being walked on all the time, pushing us down into a posture. Think about the jaw there. It's not just a hinge. It's like woven through fascia and nerve pathways into a whole mechanism for opening and closing the mouth, for breath coming in. And the artery that goes up into the brain wants a pathway through here that's open. When your head is jutted forward, all of that gets pushed downwards. The jaw muscles are kind of partially on and you're kind of clenching and grinding. You often get headaches. Your facial tension shows up. There's a lot more wrinkles on your skin as you get older. So if you're having jaw pain and nobody's talking to you about head and neck posture, you're trying to fix the jaw, but often that isn't the problem. It's a manifestation. When the head floats forward, the jaw's on guard. When the head aligns, ear over shoulder over hip, the jaw can soften. It's not coincidence. It's like being in kinship in your body. So when you're forward, you can see the tissue pulling. This goes down. Breathing's harder. But when you find your back posture, your shoulder posture, and your head posture, the jaw is parallel with the ground, the ear is over the shoulder, over the hip, and the bone above rests on the bone below. It supports you. And really critically, blood supply into the brain and the inner ear, it travels through the cervical spine. Your vertebral artery is literally in the vertebral architecture. When you have a sustained forward head, you're constantly pulling and putting pressure on that vertebral artery. Your altered natural cervical curves shuts down efficient circulation. So design really matters, and you being aware, it isn't just about aesthetics, it's about flow. When that neck comes back to retain length and ease, circulation follows, like water moving through an unbent, unkinking the hose. Also, when the head tends to shift forward, the whole body compensates. You tend to put much more weight on the front of your feet, the shoulders round, your upper back's constantly working so you don't tip forward. Your core support weakens and the back's in a strained position. Everything kind of shows up as overworked, and pain can really result from that. And so you don't want to just chase symptoms. You want to actually look at how you're presenting to the world. You don't fix a crooked door by sanding the handle, right? You have to align the frame gently. And healthy posture is not rigid. A lot of times we've been told stand up straight, and what we do is we pull our shoulders back into chicken bones, and that's not holding you up. A healthy head posture comes from the center of your core. It balances the head over the rib cage. It lets the neck lengthen with length between the vertebrae, which is so important. So if you think about this partial skull, ear over shoulder over hip, there's a natural inward curve to the neck. When the head comes back, the jaw is softened. And see this red line? That's the vertebral artery literally in the structure of the bones. When your head is jutted forward, this has to work to hold you up. And the canal this runs through gets pinched. So it's really important to realize that so many issues come from the beginning by how we hold ourselves. And when we start to address it with awareness, the body's responsive. It's like dynamic. It's alive. It's like a tree adjusting to the wind. It's not like a brick trying to brace against it. So let's try kind of a listening conversation with your nervous system. You can do this sitting or standing, right? You can do it walking, but just remember, no force. You just want to orient. So let your eyes kind of look around the room and notice as you turn left to right. How does your head and neck move? Okay? Does it go as easy to one side as the other, right? When you go around, does the head tend to go forward? I want you to take your finger on your chin and gently pull your head back. Now, straightening the curve of the neck isn't right either. We're designed to have an inward curve. So most of us who have tech neck, our head is poked forward a lot. A simple exercise of using a belt in the curve of the neck, and as you draw your head back, pull forward on your hands and let the curve be there. This is very different than pushing back and straightening the neck. You're meant to have a natural inward curve. So letting the curve be in the low neck, I'm going to hold with my hands here, let my head draw back. My posture is an internal felt sense of where my head is, my ear, over my shoulder. Have someone take a picture of you from the side and notice, am I lined up? This belt technique can feel incredibly relieving. So again, applying pressure into the curve of the neck, draw the chin back with the curve there, and then very gently rotate the neck side to side. Now you may notice I'm pulling pretty hard, holding the tissue of the skin, the tissue of the neck under the belt. And as I turn, I let my hands move, and I give some overpressure to the fascia. If this is okay for you and not painful and not radiating in the nerves, there can be a lot of reason for that. I hope you have a good physical therapist where you are. I also do telehealth sessions. As you do this, you're going to notice it's easier to kind of look over your shoulder. Look over your shoulder. And you may hear some cracking or popping. Be gentle. Probably doesn't hurt. And it's probably the vertebra and the vertebral joints letting you know, wow, we haven't done that in a minute. Because think about how much of our day is spent down like this. Bring your phone up. Work up here. Over desk keyboards. Ear over shoulder over hip. Curve in the low neck. Circulation improves. Neck and shoulder pain soften. The nervous system exits vigilance, doesn't need to do it. This isn't cosmetic work. It's working with the whole of the body. You don't need to fix your posture. You need to befriend it. Let your head be curious instead of corrected. You're not punishing yourself into it. And let your neck feel supported instead of commanded. I'm going to bet if you're consistent about this, you're going to be surprised at how much neck pain that's been persistent starts to ease up. Because these small moments of safety and movement reshape your structure. You want to regulate the body before you try to renovate things. You got to soften it, not strive. Your body, by and large, isn't broken. It's been doing exactly what you asked it to do. Tend to the keyboard, be in the world, get going. It's now time for all of us to back up, soften, bring awareness and attention to who we are and how we're carrying ourselves, and give ourselves the opportunity to rest and realign back into softness, back into awareness. If this landed for you, I'd love to invite you to stay connected. Subscribe to the channel. I'm working on these nervous system informed body-based conversations around healing, alignment, and living in a way that actually feels safe in the body. We don't push here, we listen. We build capacity gently. Thanks for being here with me. See you later, Gaias.